And we randomized women with, it was either ovarian or endometrial cancer. And we randomized them to a ketogenic diet or the American Cancer Society diet, which is essentially the standard American diet. For 12 weeks, we put them on this diet. We looked at body composition through DEXA. We looked at CA-125, which is a marker of cancer, and insulin and metabolic panels. These women, the mean BMI for the entire cohort was 31, so they were obese women. In the ketogenic group, we saw about a 21% reduction in visceral fat with a maintenance of lean tissue, compared to the other group, which had about a 5% loss in visceral fat. The other thing is obviously insulin levels went down, fasting insulin levels went down. Most of the women in the ketogenic diet through urines were in ketosis. Most of them had at least 0.5 millimolar. So the beta hydroxybutyrate suggested they were in ketosis. And beta hydroxybutyrate correlated with a reduction in IGF-1, which is thought to be sort of one of the nutrient sensors that can fuel tumor growth. So essentially what we found is the diet produced a selective loss of adiposity, which is always good, especially to reduce the risk of a recurrence in these women. And again, reduction in insulin. So if insulin does play a role, which it probably does in feeding cancer cells, at least we managed to quell that process. Quelling inflammation, I think, is really important. And the exciting thing is at least one of the markers that tends to drive some of the cancer, the IGF-1, was significantly associated with being in ketosis. So that suggests to me that at least as an adjunct treatment, this might be something to consider. There's an independent line of research that also shows that a ketogenic diet seems to make the cancer cells more sensitive to the effects of treatments, particularly radiation. And we also know that a ketogenic diet can minimize the really toxic side effects of going through something like chemo. So it seems to be a no-brainer that this is the kind of protocol that should be, to me, it should be a standard of care for someone undergoing cancer treatment. I think one of the real benefits of this eating plan for someone who's had cancer might be to reduce the risk of recurrence. And ideally what you'd like, I actually think this eating protocol, this style of eating, can turn cancer into a chronic disease. In other words, there may always be some cancer cells. We know this with glioblastoma patients, brain cancer patients, that it never goes away. And Tom Zefried's done a lot of this work. And when people kind of go off the diet a little bit, the tumor actually grows again. And then when they get back on it, it reduces. So I think the diet can actually be used much like we treat type 2 diabetes or other chronic diseases, prevent it from growing and metastasizing, which is really what we want. Psychology and behavioral strategies don't help much with the traditional calorie deficit, energy in, energy out, because you're asking people to do two unnatural things. You're asking them to be hungry, and at the same time, you're asking them to expend more energy. So that can, no matter how much willpower you have, that cannot really sustain itself. So and I think my profession has done a disservice to obese people by thinking it's a willpower issue and it's a strategy issue. I don't think obese people are obese because they overeat. I think they overeat because they're obese, because they have all this stored energy that they can't get access to because of the diet composition that they're consuming. So they are genuinely hungry. So that's why I am so intrigued by the ketogenic and the carnivore, because you are allowing the participant, the patient, to get access to their fat stores, because you're keeping insulin low, which releases the stored fat and reduces inflammation. I actually think people can get 70 to 80% of the way there by just cutting out processed food, highly processed food. But it's really difficult to do because it has this addictiveness to it. The ketogenic women ate about 62% fat, about 30% protein, and 9% carbs. And the control women that were on the Cancer Society diet, 35% fat, 19% protein, 43% carbs. So actually, that's even that 43% is probably a little lower than what the government recommends at the moment.